Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our video today. A slightly different video for you today. Most of our videos are large amounts of wax, but this is a much smaller amount of wax, but just a very, very difficult position for the wax to be in. You can see that the wax is very thin layers, but it's coated the canal wall and the eardrum. It's hardened up, so it's just causing this patient a reduction in hearing. So we have to be very delicate taking this away. So we've gone in for the smaller, fine end on the Zollner tube, so we can do a bit more delicate work. It's a tricky one to do this because you have to work very close to the ear canal wall. So as you can see, we're peeling this drier, more solid wax away. But because you're working so close to the canal wall, you do run the risk of catching the ear canal wall, and then you can get a little bit of bleeding, and it's very uncomfortable for the patient. So what you'll see us doing is we getting very close to the canal wall without touching, and just sort of scraping along the top of the wax just to try and lift it slightly so that we can get, there you go, you see it, you can see it lifting off there, so we can get a grip. Then as it lifts off the canal, we can work a little bit more safely then when that comes away. You'll see all the white bits attached underneath. That's where the skin, which naturally migrates out of the ear canal, hasn't been able to do that very well because of this solidified wax on top. So the next thing we need to do now is just clear a little bit more of the canal, and then clear that eardrum. You can see just peeling away here. This is a difficult position to peel, this bit, where it just hits that little ridge there just before it drops down to the other side. It's always really hard to peel to clear really wax that's really adhered to that section. It's quite painful for the patient because you're right on this ridge. So we're just going to switch to the eardrum now. You can see it's just very, very gently pulling on that wax. Not too aggressive with this because obviously this is a very delicate part of the ear. The membrane is paper thin. We have to be so careful here, just very, very gently lifting this drier wax away. But because it's formed this solid layer, it's really reduced that movement to the eardrum. So you can just see the wax getting sucked in to the end of the suction, just very gently moving down. Now the patient at this point is completely awake. They're fully aware of what's going on. We explain as we're going along exactly what we're doing for the patient, but we always give them proviso that if there's any discomfort, any problems at all, they can stop this procedure at any point. This patient was perfectly happy, no pain felt. Just let us carry on and get all this away for them. So we're peeling, and we're trying to keep it in one long strip if we can. What you'll see underneath as we take this away, you'll see the skin is quite white. That's because this wax has been interrupting the radial migration of skin. If you want to know about the movement of skin, we did a video on keratosis obturans, which shows the migration patterns of the skin in the ear canal. Have a look at that, it'll explain this in a bit more detail. But what we're doing now is just trying to take this away. You can see there's a little bit of movement to the eardrum there, so I'm putting a little bit of olive oil in now just to help to loosen this off the canal. So we're just taking some of the excess away. It'll just help the olive oil to get underneath, reduce the adhesion of this wax to the skin underneath it. Now we are working in a very small area here. You're talking the width of that eardrum is probably about 1 centimetre across. So you can imagine that we're making very, very fine movements. I'm trying to pull the flap of wax from right to left to try and detach it, but I'm actually running out of space as soon as I get it far enough across to the right side. So we have to lift from the bottom up, which is what we've done there. There we are. So that's come away now. There's another little piece you can see just at the bottom of the eardrum there, so we'll take that away as well. Because the olive oil's done its magic now, that's come away nicely. There we go. So that's looking nice and healthy. Now this section I'm working on here, this can be quite uncomfortable for a patient to have removed. This ridge, and working along that kind of ridge line you can see just in front of the eardrum there, is always quite difficult. A lot of patients can't tolerate it, so I've spotted that there's a wider section here. There we go. So we managed to peel just away. And you can see with the smaller suction tube, it's difficult to get a good grip on it, so we're going to opt to go to the larger suction tube now just to get a better grip. So we're lifting all of that away. You can see the olive oil getting underneath, helping us to work this off the canal wall. Here we are. And then we're going to try and collapse it down on itself from the top as well. Peeling that away. You can see it coming away there quite nicely. There we go, nice large piece. I think there's another little bit, there we are, just in the canal, so we'll get rid of that next. And I'll just get away some of the sluffy material in a second. There will be some wax left in here, and lots of people ask, you know, why didn't you clear it all, why didn't you take it all away? In some cases it's just too uncomfortable for the patient to have it taken away from that spot, and as long as it's not a huge amount of wax, the natural migration processes can kick back in now we've taken the majority of this away. So yeah, I see some redness to the eardrum there. So this is what we removed, only small pieces, but obviously causing this patient a lot of discomfort. Yeah, well, thanks again for watching today, guys, and if you did like the video, then please like, share and comment. Thank you very much.